Hello guys, I'm Miss Annabeth Pamate. So now I'm going to tackle about the cellular aberration and the breast cancer. Cellular aberration is a group of disorder characterized by abnormal cell growth and ability to metastasize with potential in killing the host. Cancer. The term cancer refers to the group of disease in which cells are grow and spread unrestrained throughout the body. Cancer is identified by aberrations in cellular structure and cellular function. What causes cellular aberration? When cells are exposed to radiation or carcinogens, DNA sometimes breaks, and the broke ends may rejoin in different patterns from their original arrangement. And for the breast cancer, it's a disease in which cells in the breast grow out of control. There are different kinds of breast cancer. The kind of breast cancer depends on which cells in the breast turn into cancer. Breast cancer can begin in the different parts of the breast. Breast is made up of three main parts such as the lobules, ducts, and connective tissues. For the lobules are the glands that produce milk. The ducts are the tubes that carry milk to the nipple. And connective tissues, the connective tissue, which consists of fibrous and fatty tissue, surrounds and holds everything together. The most breast cancers begin in the ducts or lobules. Breast cancer can spread outside the breast through blood vessels and lymph vessels. When breast cancer spreads to other parts of the body, it is said to have metastasized. Kinds of breast cancer. The most common kinds of breast cancer are invasive ductal carcinoma and invasive lobular carcinoma. For invasive ductal carcinoma, it is the cancer cells begin in the ducts and then grow outside the ducts into other parts of the breast tissue. Invasive cancer cells can also spread or metastasize to other parts of the body. Invasive lobular carcinoma, it is cancer cells begin in the lobules and they spread from the lobules to the breast tissues that are close by. The invasive cancer cells can also spread to other parts of the body. What are the symptoms of breast cancer? Breast pain can be symptoms of cancer. If you have any symptoms that worry you, be sure to see your doctor right away. Different people have different symptoms of breast cancer. Some people do not have any signs or symptoms at all. Some warning signs of breast cancer are the new lump in the breast or underarm, thickening or swelling of part of the breast, irritation or dumpling of breast skin, the redness of or flaky skin in the nipple area of the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, including the blood, any change in the size or the shape of the breast, pain in any area of the breast. Keep in mind that these symptoms can happen with other conditions that are not cancer. What are the risk factors of the breast cancer? First, not being physically active. Women who are not physically active have a higher risk of getting breast cancer. Second, being overweight or obese after menopause. Older women who are obese have a higher risk of getting breast cancer than those at a normal weight. Third, reproductive history. Having the pregnancy after age 30, not breastfeeding, and never having a full-term pregnancy can raise breast cancer risk. Fourth, drinking alcohol. A woman's risk for breast cancer increases with the more alcohol she drinks. If you have a strong family history, breast cancer, or inherited changes in your genes, you may have a higher risk of getting breast cancer. How is breast cancer diagnosed? Breast ultrasound, diagnostic mammogram, breast magnetic resonance imaging, and the biopsy may be used to diagnose breast cancer. How is breast cancer treated? Breast cancer is treated in several ways. It depends on the kind of breast cancer and how far has spread. Breast cancer treated in surgery, chemotherapy, hormonal therapy, biological therapy, and radiation therapy. People with breast cancer often get more than one kind of these treatments. So that's all for my topic.
Assalamualaikum. So my topic is about a colorectal cancer. So a colorectal cancer, it is a disease in which the normal cells in the lining of the colon or the rectum begin to change and start to grow uncontrollably and no longer die. So the colon cancer, it is typically affects the older adults, though it can happen at any age. So it is usually begins as a small and cancerous benign clumps of cells called the polyps that form on the inside of the colon. So the symptoms of the colorectal cancers are rectal bleeding, persistent abdominal discomfort such as cramps, gas, or pain, a feeling that your bowel doesn't empty completely, weakness or fatigue, unexplained weight loss. So the cause of colon cancer begin when healthy cells in the colon develop changes or mutations in their DNA. So the risk factors are old age, African and American race, personal history of colorectal cancer or polyps, then the inflammatory intestinal condition, the inherited syndromes that increase the colon cancer risk, the obesity, smoking, alcohol, and etc. So the treatment for the colon cancers are surgery, radiation therapy, drug treatment such as chemotherapy, the targeted therapy, and the immunotherapy. So, if you have an increased risk of colon cancer, discuss your risk factors with your physicians to determine whether preventive medication are safe for you. So, my next topic is about the lung cancer. So, the lung cancer is a disease of uncontrolled cell growth in tissue of the lungs. So this growth may lead to metastasis, which is the invasions of the adjacent tissue and infiltration beyond the lungs. So the main type of the cancer, the lung cancer, is the small cell lung carcinoma and the non-small cell lung carcinoma. So the first one is it is usually responds with a better chemotherapy and radiation, while the second one is the sometimes treated with surgery. So the common cause of the lung cancer is long time exposure to tobacco smoke. So symptoms of the lung cancer includes the chest pain, cough that is not easily go away, and then the coughing of blood, the fatigue and weak, and the hoarseness. So treatment for the lung cancer, there are treatments for lung cancers and there are therapeutic options available. So regardless of its staging when first diagnosed. Thank you.
Good day, I am Sulina Ed Suleiman, BSN 3 Libra. So for now, I'm going to discuss cervical cancer and liver cancer. So let's start first with cervical cancer. So cervical cancer affects the entrance to the womb. So the cervix is the narrow part of the lower uterus, often referred to as the neck of the womb. So we have here the most common symptoms of cervical cancer are bleeding between periods, bleeding after sexual intercourse, bleeding in post-menopausal women, discomfort during sexual intercourse, and also vaginal discharge with strong odor, and lastly is the pelvic pain. So these symptoms can have the causes including infection. Anyone who experiences any of these symptoms should see a doctor. So we have 4-stage system, which is common way to stage cervical cancer. So in stage 0, which is the precancerous cells are present. In stage 1, cancer cells have grown from the surface into the deeper tissues of the cervix and possibly into the uterus and nearby lymph nodes. So next is in stage 2, the cancer has now moved beyond the cervix and uterus, but not as far as the walls of the pelvis or the lower part of the vagina. So it may or may not affect nearby lymph nodes. So in stage 3, cancer cells are present in the lower part of the vagina or the walls of the pelvis. It may be blocking the uterus, the tubes that carry urine from the bladder. It may or may not affect nearby lymph nodes. So the last stage which is the stage 4, the cancer affects the bladder or rectum and is growing out of the pelvis. It may or may not affect the lymph nodes. Later in stage 4, it will spread to distant organs, including the liver, bones, lungs, and lymph nodes. So undergoing screening and seeking medical attention if any symptoms occur can help a person access early treatment and increase the chances of survival. So causes. Cancer is the result of uncontrolled division and growth of abnormal cells. So most of the cells in our body have a set lifespan. So, and when they die, the body generates new cells to replace them. So abdominal cells can have two problems. So first A is they do not die. Second is they continue dividing. So, however, some risk factors might increase the risk of developing cervical cancer. This include HPV, or next is having many sexual partners or becoming sexually active early, smoking, a weakened immune system, birth control pills, other sexually transmitted diseases, socioeconomic status. So the treatment for cervical cancer options include surgery, radiotherapy, chemotherapy, or combinations of these. So deciding on the kind of treatment depends on several factors such as the stage of the cancer as well as age and overall state of health. So prevention, a number of measures can help reduce the chances of developing cervical cancer. First is the human papillomavirus or HPV vaccine. So safe sex and cervical cancer. Cervical screening, having fewer sexual partners, delaying the first sexual intercourse, and stopping smoking. So next is the diagnosis. So cervical smear test is which is the screen does not detect cancer but looks for abnormal changes in the cells of the cervix. So without treatment, some abnormal cells can eventually develop into cancer. The HPV DNA testing. So this test determines whether the individual has any of the types of HPV most likely to cause cervical cancer. It involves collecting cells from the cervix for lab testing. So the test can detect high-risk HPV strains in cell DNA before any anomalies become clear in the cervical cells. So next is the liver cancer. So liver cancer is cancer that occurs in the liver. The liver is the largest glandular organ in the body and performs various critical functions to keep the body free of toxins and harmful substances. So what are the symptoms of liver cancer? So many people don't experience symptoms in the early stage of primary liver cancer. When symptoms do appear, they may include abdominal discomfort, pain and tenderness, yellowing of the skin and the whites of the eyes, which is called jaundice, white chalky stools, nausea, vomiting, bruising or bleeding easily. So the weakness, and lastly is the fatigue. So next is how is liver cancer diagnosed? So the diagnosis of liver cancer begins with a medical history in a physical examination. So first is the liver biopsy. So another diagnostic test available is the liver biopsy. So a liver biopsy involves removing a small piece of liver tissues. So it is always done using anesthesia to prevent you from feeling any pain during the procedure. So next is the so your specific treatment plan will be based on these factors. Liver cancer treatments may include the following. So first is the hepatectomy. So a hepatectomy is performed to remove either a portion of the liver or all of the liver. So this surgery is usually done when the cancer is confined to the liver. So over time, the remaining healthy tissue will regrow and replace the missing part. So next is the liver transplant. So a liver transplant involves replacing the entire deceased liver with a healthy liver from a suitable donor. So a transplant can only be done if the cancer hasn't spread to other organs. So next is the ablation. So ablation involves the use of heat or ethanol injections to destroy the cancer cells. It is performed using local anesthesia. The next is the chemotherapy. So in chemotherapy is an aggressive form of drug therapy that destroys cancer cells. So next we have the medication are injected intravenously and the chemotherapy or through a vein. So in most cases, chemotherapy can be given as an outpatient treatment. So next is the radiation therapy. So radiation therapy involves the use of high energy radiations beam to kill cancer cells. It can be delivered by external beam radiation or by internal radiation. So next is the targeted therapy. So in targeted therapy involves the use of medications that are designed to hit cancer cells where they are vulnerable. So they decrease tumor growth and help shut down blood supply to the tumor. Next is the embolization and chemoembolization. So embolization and chemoembolization are surgical procedures. They are done to block off the hepatic artery. Your doctor will use small sponges or other particles to do this. So this reduces the amount of blood flowing to the tumor. So, how can liver cancer be prevented? So, liver cancer can always be prevented. However, you reduce your risk for liver cancer by taking steps to prevent the development of conditions that can lead to liver cancer. So, first is get the hepatitis B vaccine. So, there is a vaccine for hepatitis B that all children should receive. Adults who are at high risk for infections, such as those who abuse intravenous drugs, should also be vaccinated. So that's all. Thank you.
Uterine. Uterine means also called womb, an inverted pear-shaped muscular organ of the female reproductive system, located between the bladder and the rectum. It functions to nourish and house a fertilized egg until the fetus or offspring is ready to be delivered. The most common uterine conditions include uterine endometriosis. Uterine endometriosis. An estimate 11% of women are affected by endometriosis, a condition in which the tissue of the endometrial lining grows outside of the uterus. Cause symptoms that include painful cramp, chronic lower back pain, and pain during or after sex. Less common symptoms of endometriosis include spotting between period, digestive problem, and infertility. So we have the next, uterine fibroid. Uterine fibroids are non-cancerous tumors that grow in the muscular tissue of the uterus. So fibroids often do not cause symptoms of required treatment. So So, for some women, however, uterine fibroids lead to heavy periods of pain. Symptoms typically treated with over-the-counter pain reliever containing ibuprofen or the acetaminophen or hormonal conception. So, in resolved cases, surgery such as endometrial ablation, neotomy, or uterine fibroid embolization may be required. So, next, uterine polyps. Uterine polyps are finger-like growths that attach to the wall of uterus. They can range in size from the small as a sesame seed to larger than a golf ball. Many women have polyps without knowing it. So, when symptoms do occur that can include irregular period, heavy bleeding, breakthrough bleeding, and infertility. So, uterine polyps carry a small risk of cancer and should be removed with a procedure known as hysteroscopy. Sometimes a dilation and curettage DNC is done to remove and biopsy endometrial polyps. Then next, tip uterus. So tip uterus, some women have a retrobelt or retroplex uterus, which means it is tip or tilt position. This anatomical anomaly usually is not detected unless a woman becomes pregnant. Usually is not an issue. So, however, some women with a filled uterus may have a higher risk of miscarriage or experience a pregnancy complication known as uterine insertion. If that happens, a cesarean delivery will be necessary. So the next, uterine cancer. So the uterine cancer, there are two types of cancer that can affect that uterus. One, uterine sarcoma, is very rare. The other, endometrial cancer, originates in the endometrial lining and it is fairly common. It typically occurs after menopause. So the primary symptoms of endometrial cancer is abnormal vaginal bleeding, which may start as a watery blood strip flow that gradually contains more blood. Abnormal vaginal bleeding is not a normal part of menopause.
So, Assalamualaikum ma'am. I am Tiago Fatima Reyes. So, my topic is prostate cancer. So, prostate cancer is a cancer that occurs in the prostate. The prostate is a small walnut-shaped gland in the males that produce the seminal fluid that nourish and transport sperm. So, prostate cancer is one of the most common types of cancer. Many prostate cancers grow slowly confined in the prostate gland, kung saan maaring hindi ito nagdudulot ng serious harm. However, ang ilang uri ng cancer na prostate ay mabagal na lumaki at maaring kailangan ng kaunting o kahit na walang paggamot. Other types are aggressive and can spread quickly. So, ang prostate cancer ay maagang nadidetect kapag ito ay nakakulong pa rin sa prostate gland and has the best chance para magtagumpay yung treatment na ito. So, let's go to the symptoms.
yan yung prostate gland. Usually, nag-happen siya sa male. So, let's move on to the symptoms rather. So, first, trouble urinating. So, yung symptoms ng prostate cancer is may cause no signs or symptom in its early stage. Kapag in early stage na yung prostate cancer is wala siyang signs. Yung prostate cancer naman, yung mas advanced ay may cause signs and symptoms. So, yan yung symptoms ng prostate cancer. Trouble urinating. Yung problema sa pag-ihi. Yung trouble urinating. Decreased force in the streams of urine. Yung nababawasan ang pwersa sa daloy ng pag-ihi. Blood in the urine. Yung dugo. Yung umiihi tayo pag may sumasama na dugo. Blood in the semen. Bone pain, yung pananakit ng mga bones natin. Losing weight without trying. Yung unti-unti tayong nawawalan ng bigat. Erectile dysfunction. So, erectile dysfunction rather is kawalan ng kakayahan na mapanatiling matatag ang erection para makipagtalik. So, yung erectile dysfunction is usually happen in the male during sexual activity. So, when to see a doctor? Make an appointment with your doctor if you have any persistent signs or symptoms that worry you. So, pag nakakaramdam ka ng signs or symptoms ng prostate cancer, kailangan mo nang kumonsulta sa doktor para makipag-appointment sa treatment mo. So, causes. So, it's not clear what causes prostate cancer. Doctors know that prostate cancer begins when cells in the prostate develop change in their DNA. So, hindi malinaw sa mga doktor kung ano ang nagiging sanhi ng prostate cancer. Ang alam ng mga doktor ay ang cancer sa prostate ay nagsisimula kapag ang cell ng prostate gland ay nagkakaroon ng mga pagbabago sa kanilang DNA. So, ano ba tong DNA? Yung DNA ay isang cell na naglalaman ng mga tubulin na nagsasabi sa isang cell na ano yung gagawin. Ang mga pagbabago pagbabago ay nagsasabi sa mga cell na lumago at mahati na mas mabilis kaysa sa normal na mga cells. So, ang abnormal cell naman ay patuloy na nabubuhay. Habang yung ibang cell sa prostate gland natin is namamatay. So, risk factors. Let's move on to the risk factors of prostate cancer. So, factors that can increase your risk of prostate cancers include older age. Your risk of prostate cancer increase as you age. So mas risk ka sa prostate cancer kapag ikaw ay matanda na. And it's common after age of 50 sa race. For reason not yet determined, Black people is usually risk siya sa prostate cancer. Family history. If a blood or relatives such as parents, siblings, child have been diagnosed with prostate cancer, mas nag-i-increase yung risk sa prostate cancer pag may family history ka ng prostate cancer. Obesity. People who are obese may have a higher risk of prostate compared sa mga taong healthy weight. Complication. Cancer that spread metastasize. So, prostate cancer prostate cancer can spread to nearby organs such as your bladder. Yung prostate cancer kasi is maaari siyang kumakalat sa organ natin sa loob ng katawan tulad ng bladder natin, or nagta-travel siya through your bloodstream or lymphatic system to your bones of the organ's prostate. So, yun nga, nagta-travel siya sa your bloodstream or lymphatic system to your bones of the organ's prostate. So, yun nga, nagta-travel siya sa loob ng katawan natin. Incontinence. So, incontinence, both prostate cancer and its treatment can cause urinary incontinence. Treatment for incontinence depends on the type of you have. So, pag severe na yung prostate cancer ng isang pasyente is nahihirapan na yung doktor para sa how severe it is and likelihood it will improve over time. Treatment option may be include medication, catheter, and surgery. Pag severe na yung prostate cancer. So, erectile dysfunction is na-explain ko na kanina. So, let's move on to prevention. So, choose a healthy diet full of fruits and vegetables. So, eat a variety of fruits, vegetables, and whole grains that can contribute nutrient to your health. Choose a healthy foods over supplements. Choose food that are rich in vitamins and minerals para ma-maintain mo healthy levels of vitamins in your body. Exercise most days of the week. Try to exercise most days of the weeks. Talk to your doctor about increased risk of prostate. So, kailangan mo kumonsulta sa doktor about increased risk of your prostate. And that's all. Thank you.
Good morning, ma'am. Today I'm going to report my topic. So my topic is about the leukemia, cancer, and the thyroid cancer. So what is the definition of leukemia? Leukemia is a cancer of the body's blood-forming tissues, so including the bone marrow and the lymphatic system. So many types of leukemia exist. Some forms of leukemia are more common in children. So other forms of leukemia occur mostly in adults. Leukemia usually involves the white blood cells. Your white blood cells are potent infection fighters. So they normally grow and divide in an orderly way as your body needs them. But in people with leukemia, the bone marrow produces the abnormal white blood cells which don't function properly. So, treatment for leukemia can be complex depending on the type of leukemia and other factors. But there are strategies and resources that can help to make your treatment successful. So, there are signs and symptoms of leukemia. Leukemia symptoms vary depending on the type of leukemia. So, common leukemia signs and symptoms include the fever or chills, persistent fatigue weakness, frequent or severe infections, losing weight without trying, swollen lymph nodes, and large liver or spleen. So easy bleeding or bruising, recurrent nosebleeds, tiny red spots in your skin, and the excessive sweating, especially at night. Last but not the least is the bone pain or the tenderness. So what is the causes of the leukemia? Well, scientists don't understand the exact causes of leukemia. It seems to develop from a combination of genetic and the environmental factors. So there are types of leukemia. The major types of leukemia are the acute lymphocytic leukemia or ALL. So this is the most common type of leukemia in young children. ALL can also occur in adults. So the acute myelogenous leukemia or the AML is a common type of leukemia. It occurs in children and adults. So acute myelogenous leukemia is the most common type of acute leukemia in adults. And then the chronic lymphocytic leukemia, with CLL, the most common chronic adult leukemia, you may feel well for years without needing treatment. So the chronic myelogenous leukemia, this type of leukemia mainly affects the adults. So a person with chronic myelogenous leukemia may have few or no symptoms for months or years before entering a phase in which the leukemia cells grow more quickly. So that is for leukemia. So the next one is the thyroid cancer. So what is thyroid cancer? So what is thyroid cancer? So the definition of thyroid cancer occurs in the cells of the thyroid, a butterfly-shaped gland located at the base of your neck. So just below your Adam's apple, your thyroid produces hormones that regulate your heart rate, blood pressure, body temperature, and weight. So although thyroid cancer isn't common in the United States, rate seems to be increasing. So doctors think this is because new technology is allowing them to find small thyroid cancers that may not have been found in the past. So most cases of the thyroid cancer can be cured with treatment. So there are symptoms of the thyroid cancer. So the symptoms of thyroid cancer typically doesn't cause any signs or symptoms early in the disease. As thyroid cancer grows, it may cause a lump that can be felt through the skin on your neck. So changes to your voice, including increasing hoarseness. So difficulty swallowing, pain in your neck and throat, swollen lymph nodes in your neck. So if you experience any of these signs or symptoms, make an appointment with your doctor. Thyroid cancer isn't common, so your doctor may investigate other causes of your signs and symptoms first. So what is the causes of the thyroid cancer? So the causes of this thyroid cancer, it's not clear what causes thyroid cancer. So the thyroid cancer occurs when cells in your thyroid undergo genetic changes, mutations. So the mutations allows the cells to grow and multiply rapidly. So the cells also lose the ability to die as normal cells would. So the accumulating abnormal thyroid cells from a tumor, the abnormal cells can invade nearby tissue and can spread throughout the body. So what is the types of thyroid cancer? The type of thyroid cancer you have determined treatment and prognosis. So the types of thyroid cancer include, first one is the papillary thyroid cancer. So what is the papillary thyroid cancer? It is the most common form of thyroid cancer. So papillary cancer arises from follicular cells which produce and store thyroid hormones. So the papillary thyroid cancer can occur at any age. So but most often it affects people aged 30 to 50 years old. So the next one is the follicular thyroid cancer. So the follicular cancer also arises from the follicular cells of the thyroid. So it usually affects people older than age 50. So Hurtel cell cancer is a rare and potentially more aggressive type of follicular thyroid cancer. The next one is the medullary thyroid cancer. So the medullary thyroid cancer begins in thyroid cells called C cells that produce the hormone calcitonin. So elevated levels of calcitonin in the blood can detect medullary thyroid cancer. So at every year stage, thyroid cancer at very early stage, certain genetic syndromes increases the risk of medullary thyroid cancer, although this genetic link is uncommon. So the next one is the anaplastic thyroid. The anaplastic thyroid cancer is a rare and rapidly growing cancer that is very difficult to treat. So anaplastic thyroid cancer typically occurs in adults age 60 or older. So the thyroid lymphoma cancer is rare from the thyroid cancer that begins in the immune system cells in the thyroid and grows very quickly. So thyroid lymphoma typically occurs in older adults. So, treatment for the thyroid cancer. So, there are some treatment that can usually recommend by your doctor, or some of the thyroid cancer problem may undergo the surgery. So, that's all for my topic.
So, good afternoon, ma'am. I'm Yusafa Itarasave, the report about the stomach. So, for the stomach is a muscular organ located on the left side of the upper abdomen. So, the stomach receives the food from the esophagus. As food, it reaches the end of the esophagus. So, it enters the stomach through a muscular valve called the lower esophageal and sphincter. The stomach secretes acid and enzyme that digests food. So what are the four types of stomach? The human stomach is subdivided into four regions. The fundus, and then the antrum, and the funnel, lowermost somewhat funnel-shaped portion of the stomach. So, for the four types of stomach is an expanded area curving up above the cardiac opening, the opening from the stomach into the esophagus, the body or immediate region, the central and largest portion, the antrum, the lowermost somewhat funnel-shaped portion of the stomach.